Hi everyone, I'm Julie Legg and I am giving you my video for cardiovascular and lymphatic system discussion. So part A, I'm explaining to Mr. Jones in layman's terms the pathophysiology of primary, secondary, and complicated hypertension. So this is what I would say. Mr. Jones, hypertension means high blood pressure that has been happening for a long time. High blood pressure causes the blood vessels to constrict, making it harder for blood to flow through the body. Blood provides oxygen to our tissues and organs, which is vital to sustain life. Prolonged and/or untreated blood pressure can lead to permanent organ failure. Hypertension is commonly known as the silent killer because people often don't have symptoms. There are 3 types of hypertension. The first is called primary hypertension. This means the cause is not known. This form of high blood pressure occurs gradually over time and is the most common form of hypertension in adults. Primary hypertension is also called essential hypertension and occurs in 95% of hypertensive adult cases. Secondly, there is a form of high blood pressure called secondary hypertension. This type usually occurs suddenly and at first appears normal, then becomes high at times, and those pressures are unpredictable. The blood pressures in this type are usually higher than in normal primary hypertension. It's also resistant with high blood pressure medications at normal dosages and with multiple agents. This form of high blood pressure tends to occur in younger patients aged less than 30 years, may not have a family history, or be obese. There's a variety of medications and conditions that can lead to this type of hypertension, such as kidney disease, adrenal gland disorders, sleep apnea, heart defects at birth, endocrine gland disorders. These glands are released, they release certain hormones that regulate targeted organs in the body. Some medications such as cold medicines, birth control, hormone replacement therapy, and certain steroids. This type of hypertension may also be caused from illegal drug use, such as amphetamines and cocaine. Thirdly, there is complicated hypertension. This occurs when chronic high blood pressure damages the walls of the blood vessels. This type has a complicated process that inevitably causes fibrosis or scarring. Once this occurs, the blood flow in those targeted organs become dysfunctional. These affected organs can be the heart, brain, kidneys, extremities such as the arms and legs, or the eyes. Often symptoms vary, and some may include cardiovascular symptoms such as chest pain. It can cause problems with eyesight as well as difficulty with urination. You may experience symptoms similar to a stroke, and memory can also be affected as the aging. Part B. Based on the data you have about Mr. Jones, explain to him the most significantly clinical information related to hypertension in his history and review of symptoms. This is what I would say. Mr. Jones, there are risk factors that you cannot change and those that you can control with your high blood pressure. Those you cannot change are age, race, and family history. The factors that you can change are being overweight or obesity, physical inactivity, tobacco use, diet, excessive alcohol consumption, and stress. According to your medical record, I see you have a long-standing history of hypertension of approximately 5 years. There are risk factors that you can and cannot change. Risks you cannot change include your age, which at this time does not put you in a significantly higher risk at age 40. Race, being a Black man, is more prevalent in the hypertension population. You also have some genetic factors, including both parents dying from this disease. Another genetic risk factor for you may be type 2 diabetes, which was diagnosed in your mother. The most significantly clinical information that you provided are the risk factors which you can change. The first includes weight. You stated you have gained 20 pounds during the past year. Being overweight and your stated inactivity are known to increase blood pressure. Another modifiable risk is smoking, and the fact that you stopped 5 years ago is a benefit to your overall health. Hypertension is included. You also stated you don't pay much attention to your diet. Those risk factors include a diet high in sodium, low in potassium, calcium, and magnesium, high vitamin D. A risk factor is also excessive alcohol consumption, of which you stated you drank several beers every evening. Lastly, stress. You are a police officer working in a high crime area. Mr. Jones, you have quite a few of these risk factors. The good news is there are things that you can do to reduce your blood pressure. And we have part C. Choose one pathologic effect of sustained complicated primary hypertension and give Mr. Jones an understanding of its pathophysiology, as well as direction for improved self-care to avoid the complication. Mr. Jones, I am concerned mostly about your shortness of breath with activity and climbing stairs. As you stated, you have a long-standing of uncontrolled hypertension. If left untreated, it can lead to complications to targeted organs, as mentioned above. It can affect the cardiovascular system, which can lead to atherosclerosis, a buildup of plaque in the walls of the arteries causing blood flow obstruction, ischemia, which is a lack of oxygenated blood flow, which can cause pain and shortness of breath, left ventricular hypertrophy, which means an enlarged ventricle of the heart that can cause arrhythmias and the inability for the heart to effectively pump the blood out into the periphery, aneurysms, which is a weakening of the artery wall, peripheral artery disease, or sudden death. Mr. Jones, in order for us to help you with these symptoms, I'm going to recommend you make some modifications to your lifestyle. You achieved something very difficult for most, which is smoking cessation. I'd like for you to start monitoring your blood pressure at home. I'm also going to stress that a change in diet will make the largest impact for your blood pressure control. This is called the dietary approach to stop hypertension, DASH diet. This diet also has been shown to reduce cardiovascular disease, as well as benefits to improve insulin sensitivity, inflammation, oxidative process, and concentrations of fasting glucose and total cholesterol. The DASH diet includes reduction of salt intake, as well as consumption of fruits, vegetables, low-fat dietary products, whole grains, fish, and nuts. Reduction attempts should be made for red meat, sugar-containing beverages, sweets, cholesterol, total fat, and saturated fat. This promotes a higher intake of nutrients such as vegetable proteins, potassium, calcium, magnesium, and fiber.